Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, everyone knows what it feels like to be stressed. In fact, the average person has 150 undone tasks at any given time. Now, it might be a leaky faucet or an unpaid bill or that project at work. In fact, our daily lives get in the way of our happiness. And stressful situation like the holidays, and they're coming up, they can make matters even worse.
What can we do to manage our stress? Can we train ourselves to be happy? Can we learn resiliency? Here to discuss how to deal with stress is stress management and resiliency expert Dr. Amit Sood. Dr. Sood is the author of the Mayo Clinic Handbook for Happiness. Welcome back to the program, Dr. Sood.
Thank you. Thanks for having me here. Sometimes when I have colleagues meeting me in the elevator and they ask me, how are you doing? My usual response is less than perfect, but better than expected.
That's a good way to look at it.
Yeah.
You know, Dr. Sood, I just thought of 151 things I need to do today, and I'm sort of stressed out. Help me.
Sure. I think the first thing you can do if you have 150 undone tasks is to make a plan, because you can't really finish all of those. So research shows that even if you have not completed the task, but if you have made a plan, it occupies less space in your head. And then you're able to free up your sort of cognitive bandwidth to really fully engage with life. The second thing is, I think the list of tasks to do should not be longer than what can come on a small post-it note. If you have a long list, then things that are less important will crowd your day and will prevent you from doing the two most important things.
I need to go back.
Put the two most important things at the top.
Yes.
Well, and if you get those done, you
in
relax.
all caps, bold, and big font.
Okay.
I have to go back to the make a plan part, because that's the first step. Are you saying, and then you made it into the post-it note, so are you saying make a plan being that you write it down? Is that how you make a plan, or is this something that you do just mentally?
Oh, well, typically it's something tangible. So typically what I do is, say, if I have to work on a project, I'll note it on my calendar 3 days from now. And I really don't feel like doing it right now because it's sort of boring. Then I note it on my calendar 3 days from now, give myself half an hour or something like that. If there's something I really need to do tomorrow morning and I'm worried I'll forget, I put it in my wallet because I know I'm going to carry my wallet. So, or send an email to myself. So that way, when you're sleeping at night, you do not have all these open files preventing you from getting into a deep sleep.
You know, you have two books out now. One, the Mayo Clinic Handbook for Happiness, and of course the one you wrote, I think previously, Mayo Clinic Guide to Stress-Free Living. Which one's better? Which one do I buy first?
It depends. If you are looking for a light sort of weekend, 1 or 2 day, you want to just get it over with and not be stressed. You've not read the book, then the guidebook for happiness will be good. I think if you really want to get into a little bit of depth of the science, the neuroscience, the evolutionary biology, and more stories, then stress-free living. My personal favorite, I mean, it's like two kids, but my personal favorite is the stress-free living book.
Well, when it comes to switching off the mind or closing some of those, I remember once you described it as the 150 open files going all the way across the top of your computer. Yeah. When I started to imagine 150 files and then imagined clicking some of them closed, that was really helpful for me. So I guess that it worked. I guess that it is something that you can learn. It is a habit. The whole thing becomes a habit, whether you let it pile up or whether you figure out a way to let it go away.
Exactly. See, they will never be done. So there won't be a day when all your, all the open files are closed and you can completely relax. That day is not coming anytime soon. So sometimes people say, so what to do with emails? And I read this very interesting perspective, and it said, you just died, and 2 minutes later, an email comes that needs an urgent response. What are you going to do about it? So that's how. So we really need to prioritize, and sometimes we do this 2x2 grid, where focus on what is controllable and important. Relationships, health, work, spirituality, but things that are controllable but not important. If I find my colleagues slurping while drinking coffee, it's controllable, I can comment, but it's going to cost me more, cost my relationship. So anytime the cost is more than benefit, you got to let it go. And something that is not controllable, whether it is important or not, you have to accept it.
So all of us have had instances during the day, whether we're at work or at home, where you just sort of get stressed out. You get that email or that extra patient or that bad news or whatever. What are some techniques that you can use right now to help you relax?
See, if you're in the throes of an acute stress response, you're a little bit behind the curve, because when you have too much adrenaline coursing through your system and your brain is sort of suffused with norepinephrine, when your heart is beating at 120 beats per minute, you can't think straight, and you're not even listening or hearing to what others are saying. A few ideas that might help. So you want to prevent that from happening and have a preemptive plan. But few ideas if you're in the throes of it is pause, take a deep breath, distance yourself from that situation, and try to reframe with a different perspective. Maybe particularly if you're trying to blame somebody that, oh, this is coming because of this person's mistake, then you're going to get even more angry. See if you can be grateful for what is right within what is wrong. Like our 3-year-old was very sick with a bacterial infection. We were very worried. This was her 3rd infection, and we came out. We were very stressed out, and we said, you know what? Thank God for antibiotics. Thank God for Mayo Clinic. Thank God for all the wonderful physicians we had. So suddenly our stress converted to hope that, hopefully this will not happen again, but if it does, we have a plan. So you want to have a plan ahead of time, but if you're in the throes of it, get all that norepinephrine, adrenaline out of your system by taking a few deep breaths, distancing yourself, and thinking from a new perspective. And if you must shout, go upstairs, shout into a pillow.
One of the things that you were talking about, daily life, whether it's something that's happening at work or at home, as we head into the holidays. Everybody survived Thanksgiving, but now they're thinking, I'm going to get together for my yearly gathering with all of my relatives or whatever the situation might be. Are there any special, it's kind of the same thing, but any special ways that any tricks that we can use on ourselves as we head into the holidays?
Absolutely. So recognize that holidays are about relaxation and relationships. It's not about being very ambitious or packing too much. Now, what is going to happen is you'll meet all these wonderful people you have not met for a year or 2 years. So you've forgotten their quirks, and that you are borderline allergic to them.
That's a great way to put it.
Yes. Sometimes I see people who make me annoyed. I just say I'm just allergic to them, and I take the Benadryl of compassion, and I take the EpiPen of forgiveness. So the way I approach this is first plan that if Aunt Sarah is going to come, and if she says, what am I going to do? What will be my reaction? I often use preemptive forgiveness. So I actually, even before meeting Uncle Todd, I might give him 3 tickets of forgiveness. Okay, the first 3 times he annoys me, I've already forgiven him before meeting him.
Preemptive forgiveness.
Yes.
Good.
Yeah.
And send them home early. That's the other key to the whole thing. Yeah. Dr. Amit Sood, who is author of the Mayo Clinic Handbook for Happiness and the Mayo Clinic Guide to Stress-Free Living. By the way, I like that tie. I didn't know they made the Mayo Clinic tie in that color. It's beautiful.
Yeah.
Unfortunately, our radio listeners can't see it, but what color do we call that?
Red.
Yeah.
It's red.
All right, time for a short break.
When we come back, myth or matter of fact, stress can cause cancer and other health problems.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Our guest is Dr. Amit Sood. He's a stress expert, relaxation expert, and also author of 2 wonderful books, the Mayo Clinic Handbook for Happiness and the Mayo Clinic Guide to Stress-Free Living.
Those books might make wonderful Christmas gifts.
Oh, they
I'm just
would.
saying.
Are they that good?
They are that good. They are that good. Let's say myth or matter of fact, stress can cause cancer and other health problems. Is that a myth or is that a fact?
I would say it is a fact. So stress, we know, predisposes to a lot of conditions that cause cancer. Like people who are smoking are not able to quit when they are stressed. Stress leads to emotional eating, which leads to weight gain. When you're stressed, when you fall off the wellness bandwagon, you stop exercising. So in fact, most of the risk factors for cancer are closely related to stress. So we know that stress can increase your risk of cancer. And we also know that we know for sure is that stress can increase your risk of cancer progression and cancer recurrence.
You know, Dr. Sood did a TED Talk, Dr. Shives. Did you know that?
I did not. I
Yes.
haven't seen that one. I've seen a few TED Talks.
Did a
so
TED
they're all
Talk.
good.
And I thought of you recently, Dr. Sood, when I watched a TED Talk that had to do with the idea of using stress to your benefit instead of looking at it as a negative, saying that I'm feeling this stress and I know that I've got what it takes in me to make this work for me. And I thought, when I heard this woman's take on that, I thought, I wonder what Dr. Sood would think about that. Can you use stress to your advantage? Can you just change the way you think about the stress? You're talking about ways to kind of circumnavigate the stress, but can you use stress to your advantage?
To a limit. Stress is a bit like spices. You need some spices in your food. So vacation is a good stress. But vacation is not just about, relaxing on beaches. It is also about, diaper change at 36,000 feet and lost wallets and mountain of emails that accumulate. So, but that is still a good stress. Promotion is good stress. So you need good stress. But bad stress is when you have to pack 10 pounds of sand in 3-pound sandbag day after day after day. And that you don't want. And there are times when the stress is ugly, like being diagnosed with a serious condition that came out of blue. So we want to have good stress. It is like friction. It makes life happen. We want to convert bad stress into good stress by avoiding demand resource imbalance. And we want to be prepared for ugly stress.
I did listen to one TED Talk, I think, on stress, and it said, make stress your friend. Stress and I have not become friends yet, despite the fact that I listened to that talk.
It's a good thing to say, but when you are in the throes of it, particularly when bad things are happening around you, to people who you really care about, it is very difficult to make stress your friend.
I know you've got these techniques, and you use all these great words, and I know they work. And if you follow them and read your books, and they're wonderful. But I want to ask you about, there are still a lot of people out there on medications for, and anxiety is one of the most common mental illnesses there is. And when I was, a few years ago, Valium was the most commonly prescribed medication in this country. I think it's now anti-cholesterol medication, but there are still a lot of people out there on anti-anxiety medications. You agree with that? Or do you think that there are better ways to handle this?
Well, we shouldn't take a us versus they attitude. So there is what I believe a 3-strike hypothesis. People who have significant mental health issue, they usually have a genetic predisposition, which is pure biology. They had difficult childhood of some kind. Either they were abused, had poor role models, etc. And then something happens in adult life, which just throws them off the curve. So when people are having, say, acute recurrent panic attacks, have severe depression, have hallucinations, things like that, absolutely, you need medications to help them. But medications alone should not be the answer. I think we should combine medications with some of these resilience techniques to make us stronger and hope that eventually we won't need the medications.
Yeah, so let's move into talking about resiliency, because that's, I don't know if it's fair to say it's a new way to look at life, but it's probably the newest and greatest way to think about making your life better, is to be more resilient. Is that fair to say?
Absolutely. So what we have realized is that while there is demand resource imbalance, we have 150 undone tasks, right? I mean, so corporates and consumers both are thinking, can we decrease the load on us? But decreasing the load is not that easy. What am I going to give up? It is probably easier and more effective to increase your capacity to lift that load. And that is what is resilient. Resilience. Resilience is your ability to lift the load of life. It's your core energy. It is your ability to withstand adversity, bounce back from adversity and preempt and grow from adversity. So a lot of research has happened in the last 2 decades, which has shown that we can significantly enhance our resilience.
I think, though, that I've always thought of resiliency as an unfortunate byproduct of going through tough times in life. That if something bad happens and you make your way through it, as painful as it is, no matter what it is, if it's emotional or a medical situation, when you survive it and you can look at it in the rearview mirror, that helps to expand your resiliency. Unfortunately, it's a good part of it, of the bad thing.
Yeah, I think transformation through disruption. But the question is, who is not going through rough time in life? When I turn on the TV and look at headline news and see what's happening in the world or even even nationally, when I'm seeing somebody else hurting, actually my brain starts hurting. That is what science shows. If I see you in pain, I actually experience pain in my own pain network. So almost all of us are going through tough times in one or the other way. So I think all of us can be helped by being a little bit more resilient.
A couple of other terms that you use that I'd like you to expand on are acceptance and forgiveness. Tell us about those and what your why you use those terms and how we should use them.
So acceptance, sure. Acceptance is forward-looking. Acceptance is saying, now that I've got this situation, am I going to keep fighting myself and going down the quicksand, or am I going to look forward and come out of it? So acceptance saves you that energy. Acceptance. So, and what happens is, when we are together, for example, in a relationship, we start taking each other for granted. Honey, I love you, but now please change. Right? I don't know if you. So that is not acceptance. Acceptance is recognizing our own quirks and other person's quirks and accepting them for what they are. And that's what helps you save the energy to grow. Forgiveness is so important. I'm sure I goof up every single day, and weekly I do something which I should not be doing. And if you didn't forgive me, if my wife didn't forgive me, if my kids didn't forgive me, life will become very difficult.
If you don't forgive yourself.
Exactly, and forgiving yourself, that is very, very important. So forgiveness is not condoning, justifying, denying. Forgiving is for yourself. You do not forgive because sometimes others deserve your forgiveness. You forgive because you want to decrease your own risk of heart attack, stroke, and dementia. So you're forgiving for yourself more than anything else. In our program, the Stress-Free Living program, Mayo Clinic Resilience program, we forgive only on Fridays. So you only have to forgive on Fridays, and that makes life easier.
So tell us about that program. How do you get into it, and how long does it last?
So
not on Fridays, though, huh?
So that program, which we call Mayo Clinic Resilience, is taught at Mayo. We've done over 20 research studies. You can learn the entire program in about 2 hours. It is a gist of the Mayo Clinic Guide to Stress-Free Living and Mayo Clinic Handbook for Happiness. We teach it in clinical practice to patients. Every Wednesday, we teach it as workshop, and we go all over the world now. And people come from all over the world to train in this program. We reach about 50,000 people a year with it.
Wow.
And as a parting shot here, give us the three-part steps of the stress management and resiliency program.
Sure. So the first part is awareness. You become aware of what neural vulnerabilities we have. Why do we get stressed? And from an evolutionary perspective, it's a very validating model. So awareness. The second part is attention. What part of my experience am I attending to? Do I attend to the fact that you load dishwasher like a garbage can, or do I attend to the reality that you are loading the dishwasher? So attention, and where you attend, what you attend becomes your reality. And part three is your attitude. What kind of mindset do you carry? Do you carry courage, hope, inspiration, can-do attitude, or are you negative all the time? So those are the three core parts, and we found that their integration leads to phenomenal rise in resilience.
I've decided the color of that tie is watermelon. Dr. Amit Sood, stress expert, resiliency expert. So good to have you with us. Thanks so much.
Thanks for having me.